So, what is the PTA program?
The PTA program is the Physical Therapist Assistant Program. So the Physical Therapist Assistant who assists the PT, and the PT would delegate their plan of care, kind of their interventions that they would have from the evaluation to the PTA that helps kind of carry out treatments. Yeah.
Okay, thanks. So this program, has it been off for a couple years for CCC and it's back, correct?
It has taken a 1-year break to kind of get the curriculum and planning stages back in order, and we're just working hard and diligently to make sure that we are aligning everything with our accrediting body, as well as making sure that we are preparing the students for the board exam, which is the ultimate licensure pass exam that they have to take at the end of the curriculum after they graduate.
Okay. So when does the PT program start? And do they have to apply?
Have to apply to the college, but they also then have to apply to the program. So there's about a year of prerequisites that they have to complete, and then they submit their application along with the prerequisites, along with observation hours. And once everything is submitted, then they would be extended a offer for an interview, and then if that goes well, then they would be accepted to the program. And then the program starts about mid-August. We're still kind of fine-tuning the dates.
And how long is the program?
Total with prerequisites, about 18 months. Mm-hmm.
So they would have some prerequisite stuff first and then the 18 months on top of that?
No, 18 months total. So it's a
18
pretty
months total.
quick and accelerated program. So they take their prerequisites, which is about a year, and then they have, once they apply, then they will get accepted to the program, and then it's 3 semesters. So they have a fall semester, a spring semester, and then a summer semester, and then they're finished.
How many students do you accept in the program?
We cap out at 24.
Okay. And you told me that the building's being remodeled. Is that something that was planned? And how is that affecting what next year's going to look like?
You want to take one?
Sure. The physical therapy assistant space, both the laboratory as well as the classroom, but mostly the laboratory, is being renovated. So we're looking at just updating a lot of the older materials within the lab, creating more space. We're actually obtaining a second laboratory, which we're calling our mobility laboratory, which will have bigger pieces of equipment and probably will be utilized more so just so that we have room for those bigger pieces of equipment without congesting our treatment laboratory. Mm-hmm. Yeah,
we have some unique pieces of equipment in the program that take up a lot of space, and we just couldn't really keep it all in one lab. So we have a Dynavision light board that's used for concussion training, concussion rehab, and also a bunch of hand-eye coordination, reaction time training. We also have a light gait treadmill for gait training, and it has some technology built into it to work on how you walk and kind of cues to help you walk better. And we also have what's called a bod pod, which is a way to monitor or kind of measure body composition. So pretty unique to have that type of equipment technology in a small community college. I've actually never seen a bod pod. I've only read about them in textbooks, so to have one's pretty neat. So to make sure that we have the space to utilize them was really beneficial to kind of snag that second lab.
So what makes Colby Community College PT program special?
Dr. Fligg and I are both new to the staff, and as far as I know, we are the only PTA program, especially in this region, who have 2 doctors of physical therapy teaching the curriculum. We've both been practicing for 10 to 15 years and can bring a lot of experience to our students just through all of the different clinical settings that we've worked in, and we're fresh out of patient care, so we're pretty up to date with a lot of the newest technology, the newest methods of intervention. So we're pretty excited about that.
Yeah, absolutely.
Okay, So why don't you tell me a little bit about, introduce yourself and tell me a little bit about your experience or your what makes you qualified for.
Dr. Christopher Fligg. I'm the PTA program director, and I have my doctorate of physical therapy from Missouri State University in Springfield, Missouri. I graduated there, and then shortly after that went to work at a critical access hospital in Southwest Iowa. So critical access hospital is very similar to what's here in Colby. So you see a little bit of everything, and I've kind of worked in those smaller hospitals for the most of my career. You have to utilize a ton of what you are taught in school whenever you work in a smaller hospital. So you're exposed to anything from a spinal cord injury. Your next patient might be a pediatric patient. Your next patient might be an ACL getting ready to go back to sport. So you really get to utilize all of what you were taught in school, and you keep all those skills fresh. And I would say that both Megan and I kind of had that same background, so we can bring that to what we have here in a rural setting, especially with this kind of area being underserved. So really looking forward to passing on that knowledge and start turning out some quality therapists.
Sure. How about you, Megan?
My name is Dr. Megan Corder. I earned my bachelor degree in biology and chemistry as well as my doctorate in physical therapy at Central Michigan University. I graduated from PT school in 2009, and I actually have been practicing kind of all over the country. I started in Kentucky doing a lot of outpatient, especially working with a lot of neck and back pain. Then I moved to a smaller town in Canyon City, Colorado, and worked at a critical access hospital there doing mostly outpatient, but some inpatient as well. And then moved to an even smaller town here in Colby and got to spend my first 2 years here working through 11 counties doing home health and skilled nursing. And then I ended up at Citizens Medical, kind of as Dr. Fligg explained, is a great critical access hospital that lets you work. I worked skilled nursing, outpatient and inpatient, so got to use a large percentage of my skills that I was taught in school, which that really is pretty neat.
Mm-hmm.
So what is your goal when you have students go through your program? What's your goal, your ultimate goal?
Yeah. I would say the ultimate goal, aside from passing the board exam, that's going to be the one main goal that we definitely want to obtain, but we also want to produce just very competent and strong clinicians for this area. There's no reason why you can't get stellar medical services in small towns, and you should also feel the same way about your medical professionals in small towns. So the same type of education, the same type of bedside manner, the same type of professionalism that you would see in a larger town, we want to make sure that we kind of extend that to kind of the rural setting as well.
I would say my first 2 years working in that large regional spread, my PTAs I didn't get to see very often. They're covering 11 counties as well, so I'm not always there to work with them one-on-one, so they have to be very good at making sound decisions to keep their patients safe. Mm-hmm. If there's something that goes awry, they need to be able to identify it and appropriately know what to do. So I would say out here where we are very widespread, we are very rural, we need PTAs who are able to function independently as possible. Otherwise, it could lead to, injury and potentially unfortunate patient care decision making otherwise. So that's something I always have in the back of my head when I'm thinking about how I will instruct these students.
Absolutely.
Okay, so if they have more questions about the program, what they have to have to get into the program, where do they find that information?
They can find it on the website. If you go and search the Colby Community College and then search PTA program, it should bring you to our landing page. On there, it has all the information regarding application process, observation hours, And if it's something else that you can't find there, you can always reach out to myself, an email or office phone, or I'm sure if you call the main line, they'll be able to direct you to me as well.
Okay, is there anything else that I missed that you guys want to talk about?
I would say that Dr. Corder and I are just very passionate about this, that we have worked with, some great therapists, and we really enjoy patient care. We really enjoy the profession, and we want to elevate the profession every step of the way. And part of that is through the education process. If we can help, 10 to 15 patients a day, but now if we're able to teach and kind of keep this program going, we can exponentially help more people. And we really look forward to spread our knowledge, our passion for the profession, and in years to come, hopefully we'll be just being able to kind of make our mark. And I want clinicians that graduate from Colby Community College to have that name stamp, so that whenever somebody hears that, they say, oh, they're quality.
Very well put.
Yeah.
Agreed.
Come see us at Colby Community College.
Go Trojans.